Hi, so welcome back. So we are passing through a very bad phase of COVID actually. So COVID, because of COVID crisis, whatever you say, either tsunami of COVID, India is going through a crisis phase. And in this crisis, I just wanted to share a few things which you need to take care as a person, as a family members, because COVID is affecting so many people, and we are losing so many of our close ones. And complications because of COVID can affect in so many ways. So one of the complications which can be prevented, which can be treated, as far as our nervous system is concerned, is a stroke. There are so many other complications happens in terms like you have post-COVID, somebody might be having headache, somebody's having seizure, somebody's having encephalitis, someone became loss of consciousness and other things which needs to be taken care definitely. And but especially today I want to stress upon on stroke and paralysis, which can affect during COVID or once the person is improved already. So he or she is improved and think that nothing can happen now, and I'm absolutely fine, and stop medicines, then this catastrophic things can happen actually. So we know that, and there are so many people we are seeing in day to day also that during COVID infections, there is a tendency of high clot formations. There is a tendency of clot formations in our body, and this clot can go into the brain actually, and then can give rise to stroke and paralysis. And this is a very, very devastating things which is happening. You wouldn't believe I'm seeing patients who are in their 20s, like 25 years, 30 years. So such a catastrophic things is there. These people are seeing during the COVID infection itself, or even after the infections, when they have found to be COVID negative, the treatment has been given, and the COVID negative, and they are doing good, and suddenly they are having a stroke. So the stress which I want to give through this video is that if your family members or someone is having or had COVID infections, and number one is he or she should take the medicines, especially the blood thinners which is given by your doctors regularly. Number two, please take plenty of fluids properly. Number four, do some sort of physical activity. It's not like I'm having COVID infections, that you are confined to home is not meaning that you should be sitting all the time, you should be lying down all the time. It's not like that, because that increases the tendency of clot formation, and it can give rise to paralysis. And if supposedly, unfortunately, does happen that suddenly become weakness of your limbs, or suddenly become unconscious, paralytic attack has happened, don't waste time. Please don't waste time. So reach to a center, I repeat, where stroke treatment is available, where there is a comprehensive stroke treatment is available, which we say that stroke ready center. Because if you reach to a center there, and your nearby stroke ready centers, then probably you will be able to reach to your brain and take out that clot, because that is very, very important. Because once you are able to take out that clot within that golden time before the damage has occurred in the brain, then there will be very good chance, there will be very high chance that the person may recover completely even. So my suggestion is the prevention which you need to take care. This is the for stroke, and supposedly somebody is having this sort of things, you need to don't waste time. You need to take care of these patients, and you need to take care of your nearer and dearer one, and take such person to a nearby stroke ready centers, and where proper stroke treatment is available. Kindly spread this awareness.